Hi everyone! Today we're going to think about ethical issues in community-based research and practice. Before I get into all the scandalous behavior though, I'd like you to think about ethical dilemmas you faced in your own life, whether related to your job or school or your personal life. I'll start by sharing some ethical dilemmas I've faced. One's related to random assignment, where one group receives an intervention and another comparison group does not. Typically, you hypothesize that the group receiving the intervention will benefit in some way. We were recently funded to do a randomized trial with the Substance Use Prevention Community Coalitions, looking at whether a technical assistance model called the Coalition Checkup is beneficial for the coalitions. So one group of coalitions gets the full coalition checkup. And we really struggled to think of what's fair for the comparison group that doesn't get the full coalition checkup. This is because the coalition checkup relies on a somewhat time-consuming assessment. From that assessment, a technical assistance provider works with you to identify and prioritize areas for growth. From there, the technical assistance providers help your coalition develop and implement an action plan addressing priorities. Hopefully, action plan implementation leads to improvements in how your coalition's working together and what your coalition's doing in the community. Then we do the assessment again as part of an iterative process focused on quality improvement. Everyone, including the control group, has to go through this fairly cumbersome annual assessment. We didn't feel good about making the control condition go through the assessment without getting anything in return, but we also didn't want to give them too much and mess up the comparison. In the end, we decided to give them the feedback report, but not the technical assistance personnel to support them through the action planning process. We felt like this was a good compromise, as all coalitions have the opportunity to use the data to improve performance, but comparison coalitions are not handheld through the performance improvement process. So that's one example of research-based ethical dilemma we faced and how we solved it. Another example that's more practice-focused is related to a program I'm working on called Healthy Fit. In that program, community health workers conduct health screenings and give people cancer screening vouchers among other resources such as support for healthy diet and exercise. For the mammography cancer screenings, the age guidelines changed and remain controversial. It used to be ages 40 and up were recommended to get a mammography, and now it's 50 and up. For the 40 to 49 age range, the guidance is that you can get one if you want, but it's a personal decision. There is potential harm in that the more tests you go through, the higher the risk of false positive, which can lead to unnecessary treatment, which is why they moved the recommended age from 40 to 50. However, the change remains controversial as several organizations still recommend mammograms at 40 and up. We've encountered several participants in their 40s who really want mammograms and cannot otherwise afford them. We really struggled as to what we should do in this situation. On the one hand, we want to support adults in pursuing desired health care, but on the other hand, we're dealing with limited resources and mammograms are expensive. Given the risk of false positives, the lack of an explicit recommendation, and limited resources, we decided not to provide vouchers in those cases. But it was hard telling people no because they could not otherwise afford a mammography. So that's another tough decision we have to live with. And hopefully you're starting to see that we're surrounded by ethical decisions every day, and you can think of some of the ethical issues you face in your own life. Now that we've thought about some of the ethical issues we face, I'm going to talk briefly about 5 philosophical approaches to ethical decision making that we can use in our everyday lives. They're utilitarianism, duty or deontology, rights-based ethics, social justice, and the ethics of caring. The first is utilitarianism, which is a popular and helpful approach to thinking about ethical behavior. It really boils down to the idea of having the greatest amount of good for the greatest number of people, which to me is a very handy rubric for thinking about ethical behavior. Now, while that's a helpful framework for thinking about ethical behavior, it leaves a lot of unanswered questions, such as what is good? Do we care about just living a long life? Or do we care about quality of life? Or maybe we just want to maximize pleasure or happiness. And then, do we care more about the good of individuals or of the larger society? And who gets to answer all these questions? So it gets sticky, but nonetheless, maximizing good for the most people is a helpful mental shortcut. It does leave open the possibility that some people will get left behind, which I think is a core weakness of the utilitarian approach. Another approach to ethical behavior is deontology, or a focus on duty, which comes from Kant. His idea is that there's right and there's wrong behavior, and we need to figure out what the right actions are, rather than focus so much on consequences. For example, you can think of the golden rule of treating others as you would treat yourself. That's your duty to treat others as ends in themselves rather than a means to an end. You can think of various duties that serve as helpful rules of thumb in making ethical decisions. One of the challenges of this approach is that not everyone really has a duty to act in the same way in the same situation. For example, if there's a burning building, is everyone obligated to go in and rescue a child from that building? I'm not sure. Certainly a firefighter is in a better position to be obligated to race into a burning building and rescue someone. So it can get sticky because it depends on the situation and it depends on the person and whether it's an obligation or maybe just a good deed. But nonetheless, it can be very helpful to think about our duties and obligations in making ethical decisions. A related perspective are rights-based ethics, which come from John Locke. At the heart of this perspective is the idea that all people are valuable in an unconditional manner, and that we as humans have rights. We can think we have a right to privacy, a right to not participate, or a right to autonomy in making our own decisions. However, the rights of others may be affected by our decisions, so you have to consider their rights too. We can think about human rights and talk about human rights violations going on around the world. It can be really helpful to clearly define individual rights and the rights of different groups. Such clear definitions can provide a lot of guidance in terms of what's an ethical decision. However, a core challenge of the rights-based ethics is that rights often conflict and it can be hard to know how to balance competing rights. For example, take the right to free speech. For the most part, it makes sense that we should have freedom of speech and that it should be a right. However, there are limits to the right, such as the classic example of not being allowed to yell, "Fire!" in a crowded theater. Here, the conflicting right to express ourselves and our right to safety and not being trampled when everyone runs out of the theater. Now, the right to yell fire seems not so important, but the stakes can be high, such as when making decisions about what can be posted on social media. So thinking about rights is helpful, but still leaves you with thorny ethical dilemmas when rights conflict. Social justice is another approach to ethical decision-making that was personally life-changing for me. If it weren't for a paper I had to write on John Rawls' book, Theory of Justice, I likely would have gone down a different career path. Despite its influence on my thinking, I still got a C on that paper. But his approach is a little different. The core idea is to think about justice through a veil of ignorance. With this hypothetical veil, you don't know which family you'll be born into or your health status. You could be born rich, poor, black, white, or perhaps without any legs, and thus needing a wheelchair. Through that veil of ignorance and not knowing your position in society, whether you're at the top or the bottom, or perhaps face some other disadvantage, you're able to make a more just decision as to how to structure society to provide more equitable opportunities. Given there's a chance that you could be disabled, it makes sense that society should invest money in putting in elevators and ramps. From the perspective of utilitarianism, you might conclude steps are fine because most people can walk, so it's not worth the investment in ramps. But from a veil of ignorance perspective, it's easy to justify because you could be the person who's disabled. This perspective serves as a rationale behind health equity and the idea that we should make an extra effort to create conditions where everyone can succeed. Rawls' theory of justice suggests society should invest substantially in giving people opportunities they wouldn't otherwise have, in order to support a more equitable distribution of resources. I often find myself trying to balance this perspective with that of utilitarianism and thinking through the ethics of a particular health promotion policy or program. The final approach to ethical decision-making we're going to talk about is the ethics of caring. This useful approach grows out of feminist thinking. Carol Gilligan and Nell Noddings are two of the leading founders of this perspective. Rather than focusing on rights and duties and other objective rules, they criticize these established perspectives as being more masculine and more aloof and impersonal. They argue that rather than trying to inform our ethical behavior with static principles, we have to think about our relationships and how to improve those relationships in real-world messy contexts. So the ethical decision is that decision that makes our human relationships better. which I personally find to be a really powerful way of thinking about behavior. So we have to ask ourselves the question, okay, what can we do to make our relationships better? And the answer to that question is the moral action. Do what makes your relationships better. It's a really compelling and different way of thinking about ethical behavior. So that's my whirlwind tour of 5 perspectives on ethical decision making. I encourage you to consider these different perspectives when you're struggling with various decisions in your personal and professional life. Now I'd like to transition to some core responsibilities that we must consider as public health professionals, especially when we're doing research. We have a lot of responsibilities to the people we work with, including respect for autonomy, beneficence, justice, and privacy. I'll talk about each of these in the next slides. Respect for autonomy is the very important principle that we need to recognize people have a right to make decisions for themselves. Some of the ways that we recognize this right is that we have an informed consent form we use to help people consider the risks and benefits of participation. This helps people make a conscientious decision about agreeing to be involved, while knowing that participation is always voluntary. So we can't be coercive in recruiting participants. One area I've seen this get tricky is with incentives, because a lot of the time we use incentives to get people to participate, and if you're working with low-income populations, a relatively modest incentive can sometimes be considered coercive because someone can't realistically turn down that kind of money, even if they have to take on substantial risk to participate in the study. So for a survey, maybe not a big deal, but if you're testing drugs or asking people to do something else that's risky, then definitely those incentives can be a problem. Along with autonomy, we have to keep in mind the principle of beneficence, which is about minimizing risk and maximizing potential benefits for participants in society. Notice that the principle of beneficence is very utilitarian. It's important to think clearly through the risks and benefits of participation. There are always unintended consequences to what we do, and it's essential to think clearly about the possibilities. The responsibility of justice is about being equitable in our distribution of benefits and burdens among research participants. For example, the testing phase of some vaccines or drugs sometimes disproportionately burdens low-income countries because participants are easier to entice with incentives. Alternatively, minority groups in the US often have lower rates of participation in cancer trials, for which participants receive free world-class treatment once enrolled. It's important that we think about how to fairly distribute these participation benefits and burdens. We also need to think about how to protect privacy, both in being sensitive about the information collected and in thinking about the dissemination of information. Of course, we want public reports to not be tied to individual names, but also we want to provide people with useful feedback about the data collected. In designing data collection protocols, I always try to make the data useful to people who participate in the data collection, which improves data quality, but it can also present challenges related to privacy that must be managed. A lot of what we do in health promotion is community engaged, and you'll work with a variety of partners throughout your career. It's critical to think about the benefits for partners when collaborating. Otherwise, you risk taking advantage of partners' initial cooperation, which will subsequently deteriorate. Or you may be unable to obtain partner cooperation from the outset because they don't benefit. So we want partners involved to benefit, and we don't want to falsely overpromise only to lose partner cooperation after collaboration has begun. One key benefit we can sometimes offer partners is capacity building. For example, in a community-based participatory research project, you can help partners build their capacity to do research that guides their action. And you can work with partners to make a collective impact as a group that's beneficial to the community. Too often, research is a one-way street, where researchers collect data from the community and then write articles for other scientists without giving back to the community. One way to avoid this is to think through how data collected can be useful to the community and then sharing relevant findings with community members. We've found success with that approach in both the Coalition Checkup and in Healthy Fit, which I discussed earlier. Hopefully you can find ways to form collaborations where all partners benefit too, as it's those small win-win-win scenarios that successful health promotion is founded on. So that wraps it up for our brief overview of ethical issues in research and practice. Thanks for listening.